everyone. Good afternoon, everybody. I'm Priyanjali, your host for today's live from All About Skin Wellbeing team. I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on psoriasis. Psoriasis, a condition in which skin cells build up and form scales in and itchy dry patches. Psoriasis is thought to be an immune system problem. Triggers include infections, stress, and cold. The most common symptom is a rash on the skin, but sometimes the rash involves the nails or joints. It can start at any age, but most often develops in adults between 20 to 30 years old, between 50 to 60 years old. It affects men and women equally. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about psoriasis and its types, how we can prevent it, the kind of tests required for its diagnosis, the right treatment and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us renowned dermatologist of India, Dr. Prachi Mahajan. MBBS DDV Mumbai is a skilled dermatologist, dermatosurgeon, and cosmetologist with advanced training in aesthetic medicine. She completed her postgraduate training in dermatology, venerology, and leprology at Dr. Balabhai Nanavati Hospital, Mumbai, and earned her MBBS from Dr. Vasantrao Power Medical College, Nasik. Additionally, she holds a fellowship in aesthetic medicine from Disha Skin and Hair Institute, Thane. Dr. Mahajan is proficient in diagnosing and treating a wide range of skin, hair, and nail disorders, as well as sexually transmitted diseases and leprosy. She is also highly skilled in performing dermatosurgical procedures, biopsies, nail surgeries, and cosmetic treatments, bringing both precision and care to her practice. She is the director of Dr. Prachi Mahajan Skin Clinic, Kalyan. A warm welcome to Dr. Prachi Mahajan. It's a pleasure, doctor, to host you today, and we are going to discuss on a very important topic, which is psoriasis. So, the first question for you would be, what is psoriasis in your language?
First of all, thank you so much for the warm welcome. Really glad to be on this platform today and interacting with you, madam, and also with the audience today. Yeah. So we'll discuss today about the psoriasis. Now, what is psoriasis exactly? Psoriasis is a chronic inflammatory skin disease which is characterized by scaly erythematous papules and plaques, which can occur anywhere on the body. Okay. Their most common sites for psoriasis, they are the extensors of the body, okay, the elbows, okay, then the knees, fine, and the palmar surface, the plantar surface, the scalp, okay, and also it can occur on the flexural areas also. Okay, so that can be confused with the fungal infection. Okay, that is one of the differential diagnosis of it. We need to differentiate it from the flexural psoriasis, need to be differentiated from the fungal infection. That is very, very important because the treatment of both is different. Okay, so
Hmm,
that is
hmm.
very important. And males and females, they are equally affected. It's not that more common in males or more common in females. They are equally affected. Okay, and less than 46 age group, 75% cases are seen that time. So there are two peaks of psoriasis which are seen. Okay, on an average, we have calculated, so it is 16 and 22. That's the peak age. Yeah.
Right. So, doctor, now tell us the cause behind it. So, is there
Okay.
one specific cause, or there are certain causes behind the occurrence of
Yeah.
psoriasis?
There are multiple causes. It is not that it is an infection or something. Psoriasis is not an infection. So there are multiple causes for psoriasis, and the exact cause, which is actually, which is very strange to talk about, but it's unknown. Like it is autoimmune thing. Okay, so psoriasis is
Right.
not because of some infection that I have got some infections, I got fungal, I'll get a treatment on it and I'm free from fungal infection. So that is not
Hmm.
about
Hmm.
psoriasis. It is very painful for us also to tell to the patients that you have to live with psoriasis. Okay, but yes, if kept properly under control, then the standard of living or the thing is better. Okay, so that we have to properly counsel the patients when we are dealing a case of psoriasis. Fine. So most and foremost cause of psoriasis is like it can be, yeah, post infectious. It can be there. It is not due to infection, but it can occur So,
Mm-hmm.
beta hemolytic streptococci, which is causing tonsillitis or pharyngitis or HIV, that can be one of the cause. Then certain drugs like beta blockers. Okay, so antihypertensive drugs, what I'm talking about, or anti-malarials, fine. Then lithium,
Mm-hmm.
tumor necrosis factor alpha, and TNF antagonist. So that can be one of the reason. Fine. So stress is very important factor. Okay, so stress and emotional upset can also lead to psoriasis. Fine, and yes, so most, as I've said before, that psoriasis is autoimmune. Okay, it is because of the antibodies are getting produced against the own skin. Okay, because of that, because of
Mm-hmm.
which the antibody excess, psoriasis is happening. So the normal layer, which takes in any normal person, it takes about 28 days for new skin to form. But in psoriasis, what is happening? In 7 days only, skin is coming. Okay, so that when we scratch it,
Mm-hmm.
scales, we typical history patient give like powder जैसा गिरता है, like it's powder like
Mm-hmm.
dandruff like
Mm-hmm.
thing is getting. So that is the skin. जो चीज अपन में बनने के लिए, हम लोगों में बनने के लिए जिसको 28 डेज लगता है, वो सोरियासिस के पेशेंट में 7 डेज के अंदर ही बन रहा है. ओके, सो दैट इज
Right.
द मोस्ट कॉमन प्रेजेंटेशन which the patient.
Right. Right. Now, doctor, ऐसे because skin is the largest organ, हम बहुत सारे changes देखते हैं अक्सर हमारे skin में. अ, ये ड्राई स्किन के साथ सोरियासिस को कंफ्यूज कैसे ना करें? डिफरेंस क्या है दोनों के बीच में?
See, dry skin will be something which is always seen like atrophic, like बहुत ऐसे रूखी सूखी स्किन दिखेगी. ओके, बट यहाँ पे
हुँ,
पेशेंट
हुँ,
टिपिकल हिस्ट्री देगा कि डॉक्टर, व्हेन वी स्क्रैच, स्किन पाउडर
हुँ,
जैसा निकलता है, वहां से हल्का सा खून निकलता है. ओके, खुजली.
हुँ, हुँ,
इचिंग इज नॉट द एवरी टाइम द मेन कंसर्न ऑफ द पेशेंट. एवरी टाइम इचिंग विल नॉट बी द मेन कंप्लेंट. इट विल बी लाइक हम खुजाते
हुँ,
हैं तो उसमें से बारीक बारीक ऐसे खून निकलता है. सो दैट वन
ओके,
हिस्ट्री. Itching can be plus minus. Some people, some patients, they
हुँ,
complain of itching. Some patients, they do not. So
राइट,
likewise, we can differentiate both of them.
राइट, राइट। स्पेशली मैं बात कर रही हूँ विंटर्स के टाइम पे, ये समय
Correct,
है
correct.
ड्राई स्किन का, ऑलमोस्ट एवरीबॉडी इज फेसिंग ड्राई स्किन। ड्राई
Exactly.
स्किन में भी कैटेगरी हम देखते हैं, सीवियर ड्राई स्किन मैंने देखा है बहुत सारे लोगों को, ब्लैक जीन्स पहनते हैं, तो ब्लैक में ना वो कलर आप आइडेंटिफाई कर पाते हो, बहुत अच्छी तरह फिगर आउट कर पाते हो। So whenever they are wearing the pants or they are opening the pants, the flakes fall down. तो क्या उसे हम dry skin ही कह सकते हैं और that is the initial stage of psoriasis?
Yeah, absolutely right. That is the initial stage of psoriasis. Initially,
हम्म,
generally the people, they tell that starting में they tell that dandruff निकलता है और उसमें से ऐसे चमड़ी निकलती है. So चमड़ी
हाँ
निकलती
हाँ
है,
राइट,
we have to examine whether चमड़ी निकल रही है. जिस dandruff and चमड़ी is both do different things. Skin is coming out.
हम्म,
So
राइट,
properly we have to examine if it is a scalp, which वहां जहां से चमड़ी निकल रही है.
हम्म,
We properly have to
हम्म,
examine the scalp. We have to rule out
हम्म,
it from other conditions. There are many conditions which mimic psoriasis. Okay, so there
राइट,
can be tinea
राइट,
capitis, a fungal infection of scalp. We have to differentiate it from scalp psoriasis. Then second is the seborrheic dermatitis or the seborrheic capitis, which I'm talking about. That has to be
हम्म,
differentiated from psoriasis. That is very important. So it is very very essential to meet the right person for
हम्म,
the diagnosis of it. So, and the other conditions also, like as you said, winters are most common, the season of
राइट,
psoriasis.
राइट,
So
हम्म,
winters mein psoriasis is going to flare up. Psoriasis is not having cure, it is having treatment. Okay, there is very
ओके,
very that is very important thing that we need to counsel the patient. Psoriasis
हम्म,
is going to leave a scar on the
हम्म,
patient's mind, on the patient's heart. So we have to properly counsel the patient regarding what is psoriasis, how it can be controlled. It is not going to keep any marks on the body. See, if we are treating the psoriasis, it is going, the skin marks and all that will fade off and it will go off. Okay. But the
हम्म,
marks which are there on the patient's mind कि हाँ अभी मेरा life खत्म, मुझे psoriasis बोल दिया. So that proper counseling is very important, which that is the most challenging thing for every dermatologist to counsel the patient. because
Right.
everybody the severity of psoriasis is different in different individuals. So
Right.
accordingly they have to counsel that way. And psoriasis is worse in winters than it is actually it gets worse when patient is facing mood disorders like anxiety, depression. And also if the patient
Hmm.
is a smoker, chronic smoker, then it is going to worsen the psoriasis. Alcoholic, then again it is going to keep the psoriasis worsen. Diabetes, peptic ulcer disease, liver disease, the gastrointestinal conditions like celiac disease, cardiovascular disease,
Hmm.
hypertension, and at last metabolic syndrome, like obesity. So all these things are
Right.
going to worsen the psoriasis. So everything has to be maintained. All the systems of the body should be maintained
Hmm.
properly.
Hmm. Hmm.
It's not that I am a dermatologist, I'm going to treat only the skin. Okay. So so that should not be the motto. It should be a hand in hand approach, like maintaining other things also. It's not that
Right.
I'm only going to treat the psoriasis.
Hmm. Hmm.
Emotionally counseling se leke maintaining all skin care treatment tak, everything should be taken properly. Plus the proper follow up should be there. Patient should properly follow up that
Hmm.
when the patient has asked to follow up with the doctor, depending on that, if there is a requirement of any immunomodulators or any change in the therapy, we can surely think for that. Yeah.
राइट, राइट। सो डॉक्टर, आपने इनिशियली कहा कि ऑटो इम्यून कंडीशन है, तो हमें ये तो पता चल गया है कि ऑटो इम्यून कंडीशन कोई भी अगर हो, तो लाइफस्टाइल मेंटेन करना बहुत ज्यादा इंपॉर्टेंट है, और वो एक दो साल के लिए नहीं, यू हैव टू मेंटेन इट थ्रू आउट योर लाइफ, कि ये सारे चेंजेस हमें हैबिट बना लेनी है। ये हम आज कर रहे हैं, कल कर रहे हैं, डज नॉट वर्क लाइक दिस। ऑल्सो, क्योंकि हम इतना सीरियस टॉपिक के बारे में बात कर रहे हैं, एंड सारी छोटी छोटी चीजें ध्यान में रखना, वो खुद बहुत ज्यादा स्ट्रेसफुल हो जाता है लोगों के लिए। एंड वी हैव ऑल्सो हर्ड फ्रॉम यू टुडे that stress can be the worst trigger for psoriasis. So,
Absolutely.
ये कैसे हम पहले तो हाउ कैन वी वर्क विद आवर माइंड, कैसे हम दिमाग से वो सारी चीजें निकालें, एंड देन हाउ कैन वी चूज द राइट लाइफस्टाइल टू मेंटेन दिस।
See, first of all, when we are diagnosed with psoriasis, okay, then it is we should actually see stress. Avoiding stress is not at all possible for anybody. My 5-year-old kid also, she also has a stress. कि अभी इधर जाना है, उधर जाना है. Everybody is having stress. Okay, so
राइट।
proper counseling के साथ साथ proper patient should also speak up the things. Like there are different doctors or different counselors who are available. They can be approached in that case.
हम्म। हम्म।
Then,
हम्म।
yoga, meditation, stress releasing exercises. Sorry, they have to be inculcated in the day to day life. Lifestyle modification in the form of diet modification or exercise routine has to be maintained properly. That plays a very important role. Yeah.
Right. Also now we are, because we are talking about lifestyle here. Uh, what people nowadays have turned into is they know how to spoil themselves. We love spoiling ourselves, we love pampering ourselves, but we don't give ourselves time. ये हम with uh, every passing day we are missing out on this, कि सब काम काम की तरफ बहुत keen हो गए हैं. People are spending most of the time working, or they will spend the time partying. These are the two things that they will do. They will earn, and they will party. But actually जो टाइम हमें अपने आप को देना चाहिए, not much, every day 1 or 2 hours every day works the best for us. Giving yourself some time, knowing कि अपने बॉडी के अंदर क्या बदलाव हो रहा है, और उस बदलाव को ठीक करने के लिए, बैलेंस करने के लिए किस किस चीजों की जरूरत पड़ती है. Just half an hour, 45 minutes of workout can almost eliminate a lot of stress from our life. Eating घर का खाना, वही सादा दाल चावल खाइए, not fancy food. Stay away from junks. आई थिंक ये जो खाने का बदलाव और ये जो वर्कआउट अगर हम डेली डे टू डे लाइफ में, चाहे वो किसी भी फॉर्म में हो, चाहे वो योगा ही हो ना, चाहे वो फ्री हैंड हो, चाहे वो कार्डियो हो, या आप वेट लिफ्टिंग भी अगर कर रहे हैं, कुछ भी कर रहे हैं, सो मेक श्योर यू गिव योर सेल्फ दैट टाइम। और ये दो बदलाव से ही आप देखेंगे कि आपके लाइफ के बहुत सारे चीजें ट्रैक में आ जाते हैं। बट अगेन tedious काम है, consistency maintain करना है, so we almost try to avoid such things. Don't do that and you will see a lot of things have changed in your life. Now speaking about the patients of psoriasis, doctor, do we suggest them exercise workout? क्या regular workout उनके लिए safe होगा या कुछ अलग type के workouts हम उन्हें suggest करते हैं अगर
Yeah.
yeah.
So, depending upon the condition, if the patient is stable, if the psoriasis is quite stable, okay, and
Hmm.
then we can suggest them कि yes, outdoor activities में जा सकते हैं, अपना routine follow कर सकते हैं, whatever a normal person is doing. But if it is unstable, if it is going more like erythrodermic psoriasis or like this type of things in which the heart might get affected, so in that case, we not non-strenuous, we suggest them for non-strenuous exercises like just brisk walking or like that, so that
Hmm.
the
Hmm. Hmm.
and obviously a cardiologist opinion or the specialist like hepatologist or that opinion is important, nephrologist is important. But then yes, preliminary basis we can start with the routine exercises.
राइट। डॉक्टर, क्या इस कंडीशन में जेनेटिक प्रीडिस्पोजिशन देखा जा सकता है? ऑल्सो बिकॉज स्किन के बारे में हम बात कर रहे हैं, हम बहुत ज्यादा कॉन्शियस हो जाते हैं कि किसी का भी स्किन इशू है तो सामान यूज नहीं करना है या टच नहीं करना है या उसके हाथ से दिए हुए खाने नहीं खाने हैं। तो क्या ये कंटेजियस भी है? इज इट पॉसिबल?
It is not at all contagious. As I said, that it is not an infective condition. It is a chronic inflammatory disease. Disease is not
हम्म।
infection. Infection is not disease. So these are the इसका दूर दूर तक there is no actually relation with the contagiosity. Okay, so not at
हम्म।
all. It is not going to be contagious. Genetic, what you're telling about, yes. Suppose if uh, some if a couple is having psoriasis, either of them, so okay, so they might transmit the genes, and I think the genes will be there of psoriasis, but they will be activated or not, they are in a state of activation or non-activation, that can't be said. Okay, so depending upon the conditions, that's what वो हमारे हाथ में नहीं होता psoriasis होना या नहीं होना, because it's all genetics. Okay, so it can be manifested in that particular individual in the next generation, or it cannot be manifested, but yes, the genes are always there.
Right. Now, moving ahead towards the treatment procedures. What are the treatment procedures which are available currently, doctor?
Yeah. So first are the topical medications, which can be in the form of moisturizers, fine. The emollients, what we are there. Okay. Application of like lubrications, like before bath, we suggest mostly that the patient can apply oil, can be applied for 30 minutes and then kept for 30 minutes, and then after that the patient can take bath with a good moisturizing bath. Okay, and after that he can apply, moisturizer can be applied overall on entire body, and on that particular area where the psoriasis patch is there, there we suggest anti-inflammatory that can be in the form of steroid, mild dose steroid. We can go with that if the plaque is, it's a solitary plaque that only some part of the body small part of the body is affected. If it is a erythrodermic psoriasis, then we can't, that's a steroids are a big no, we can't apply steroid ointments or we cannot apply steroid lotion for that. Okay. Sorry. So yeah, so what I was talking about is emollients play a very important role. Psoriasis is dry, dry, dry. So the treatment is moisturize, moisturize, and moisturize. This rule is very, very important in case of psoriasis. If it is a scalp psoriasis, then yes, we can go for a shampoo which is a full tar shampoo, or any like which is containing that uh, salicylic acid based shampoo, or likewise we can and go with that thing. Okay. uh, so depending upon that we can go ahead. So if it is a nail psoriasis, then again we can maintain likewise. So multivitamins also play important role. Vitamin D analogs are very important. That can be in the form of topical treatment. Okay, so we can go ahead with that thing. Yes, the immunomodulators, immunosuppressants are there like methotrexate and cyclosporin. Okay, the tofacitinib molecule, that can also be a line of treatment. So it is all depending upon the severity of psoriasis. We guide the patients for treatment. Okay, so it is very important that early diagnosis and proper treatment is very important. There is no cure for psoriasis, but yes, treatment is there. Fine. So we can go with that type of things. Apart from that, we can also advise patients if you are starting some immunosuppressants for the patients, then there are certain blood investigations which are supposed to be done, and then after that only depending upon the levels of the blood investigations which we are doing, the dose can be maintained. Okay, so that is very important. Yeah.
Right. Uh, so because we are talking about medications, now we see a lot of people go for self medication if you're talking about skin. अक्सर लोगों को पता है कि कौन सा दवाई लगाना है, या फिर वो केमिस्ट को जाके पूछेंगे कि भैया देखिए ये स्किन इश्यू हो रहा है, गिव मी अ मेडिसिन, या कुछ भी आप रेफर कर दो. So this is how it runs normally. So can this self medication be harmful for the patients? If yes, then how?
See, self medications matlab it can be, see, it can be self medications can be because can be we can differentiate that too. First is जो घर में available है वो, there are certain places in rural areas where people apply what
Mm-hmm.
not, what they get in the kitchen. जो मसाले का जो
Right.
डिब्बा होता है, the very important thing is like turmeric. Okay,
Yes.
so they go and apply turmeric on there. They then इसका जूस, उसका
Curd.
जूस, एलोवेरा का जूस, कर्ड हो गया या नींबू हो गया, कुछ भी they
Mm.
go on experiencing that. And what is
Mm.
happening, that turns out to be dangerous for the patient. Either the skin of that particular area is dangered. Okay, so so that is very difficult for management. So I would like to suggest that home remedies are not that effective. Yes, application of oil is okay, like that also before bath. Many people apply oil after bath. So after bath oil laga ke, it's not going to help you. In spite, it is going to worsen the psoriasis. So proper thing should be applied on at proper timing. Okay, so that is important. And other thing is like medical people, they go at certain chemist shop and then they say kuch bhi btex ya fir or over the counter products, they keep on applying on that thing. They keep on applying, but then when they don't find that these are better, then they come to the doctor. So that should not be the case. Okay, so don't I would like to give a message that कि आप don't worsen the situations, don't worsen the disease and then you come to the doctor. Rather, when
Mm.
the disease is like starting only, then only it is better to visit to a doctor so that proper treatment can be initiated.
Right, right. Now, doctor, also स्किन कंडीशन, काफी सारे स्किन कंडीशन ऐसे होते हैं कि जिसमें धूप अवॉइड करने का कहा जाता है. What about psoriasis? Can the sun be helpful, or should one avoid the sun?
See, sun is actually 90% sun can be, actually it can be helpful. When we are talking
Hmm.
about the treatment, that time phototherapy is also one option which we suggest to our patients. Okay,
Hmm.
so
Hmm.
sun is the very very important source. Okay, but then it should be done with a proper dose by phototherapy measures methods. It should not be like that, yes, I'm having and I'm sitting in the sun. Okay, some patients can get benefited with that thing, but then 10% it is found that 10% that it can damage, it can worsen the psoriasis. So that also should be kept in mind. Okay.
Right. Now, speaking of the regular skincare, we know the importance of skincare in today's world. Everyone, be respective of the gender, uh, everybody is into skincare nowadays because they are getting to see the results. What about people who are into skincare regime every day and the person is also suffering from psoriasis? What kind of skincare should one take in on a regular basis? Should it be under a dermatologist's guidance, or he or she can apply all those regular products which they get in the market?
May it be a psoriatic patient who is following skincare, or it might be a normal person who is not having psoriasis. Either of the
Hmm.
cases, proper
Hmm.
guidance has to be taken. I'm not telling that each and every one in on this planet requires a medication. It is not medication.
Hmm.
It is a proper routine which we have to follow. ऐसा नहीं रहेगा कि हम चक्कर काटते रहे. Okay, a proper routine has to be understood, that what has to be the line of management. So first let us talk about psoriasis person. A psoriasis person, if see, psoriasis generally doesn't affect the face, okay, but when it start affecting the scalp, when the flakes are coming, okay, so in that case the dryness of scalp is so much that it can, cause irritation on other areas of the face also. Okay, but I'm not telling that psoriasis will occur on the face. But to prevent that, first of all, proper shampooing, selection of a good shampoo is very important. So for that, yes, proper dermatologist guidance will be helpful. So proper guidance about the shampoo, conditioner, that is very important, okay, to prevent the further complications, yeah, which might occur on the face, or which might occur on the back, okay, on the hair or the scalp. So that has to be understood. Properly cleansing the face is very important. After that, this I'm talking about psoriasis patient. Psoriasis patient generally have a dry skin. Okay, it's not that they might not have a oily skin or a combination, but most of them have dry skin. So that type of cleanser should be chosen, or that type of sunscreen has to be chosen, which is going to be moisturizing for the face or moisturizing for the body. So that type of skin regimen should be followed. And
Hmm.
if a normal person is also want to, get the guidance about face wash, sunscreen, lightening cream, depending upon the skin type, depending upon the skin texture, that can be taken.
Right. Now, for all the people who are into medications and who are wondering कि ये तो ठीक नहीं हो रहा, and this not gonna be okay, this gonna stay like this for the rest of the life. Just for them, ये medications normally कितने दिनों तक लेना पड़ता है या lifelong maintenance है?
See, that I said, that is also a little bit challenging part, not only for the patient who is
Hmm.
undergoing treatment, but the doctor के लिए भी
Mm-hmm.
it is very challenging to explain the
Right.
patient about the psoriasis. I'm
Mm.
so sorry. So in that case, what I said, proper thing is very important, that what patient has to be, what will be the routine of the patient. See, जैसे कि methotrexate is a drug, okay, so that need not to be taken throughout the life, और ऐसा नहीं है कि cyclosporin जिंदगी भर लेना पड़ेगा, ऐसा नहीं रहता. That are going to be the immunosuppressants as and when required, that has to be done. जब डिसीज कंट्रोल में आएगा, तब वी हैव टू follow certain regime which is going to maintain proper hydration of the body. So ऐसा नहीं है कि एक मेडिसिन स्टार्ट किया तो वो जिंदगी भर चलेगा. ओके, जैसे कंट्रोल में आने के बाद वी कैन टेपर दैट ऑफ, और वी कैन वीन दैट ऑफ. सो दैट typically it depends on the condition of the patient.
Right. Right. Doctor, because immunity we are talking about here, should one also focus on developing the immunity when we are talking about psoriasis?
Yes, because psoriasis can psoriasis is going to what I said, that scratching powder जैसा गिरता है उसमें से फिर बाद में खून निकलता है. This is the proper history
Mm-hmm.
which people do. So that can cause the infestation of microorganisms, bacteria, fungus. So that can be there. Okay. So again, secondary infection can be caused. So yes, care has to be taken that way.
Right. Moving ahead, doctor, towards the next question is, what is this psoriatic arthritis? इसमें क्या होता है?
See, psoriatic arthritis is it can be a sequelae of psoriasis, which is affecting any part of the body, especially in between the joint, the small joints. The small joints of the hand, they get stiff. Okay,
Mm-hmm.
so when we are dealing a patient of psoriasis, we are supposed to also check whether he is having joint involvement or not. So in that case, we ask the patient ki सीधा हाथ रखो, and then we ask them to do certain movements. So in that case, if it is painful, or sometimes the patient by themselves only they say ki doctor, there is slight pain in the joint which I'm finding out. So then we have to check for psoriasis. Then we have to treat them in that thing also. Either we can take the help of a rheumatologist, we can send them, refer them to rheumatologist for proper arthritis treatment, psoriatic arthritis treatment, that can be done. The small joints of the body are generally affected in that case.
Right, right. And with
Involvement can
time,
be.
if the person, right. So, doctor, with time, if the person is prolonging a treatment or maybe not taking proper care of the disease or being negligent towards the condition, what can be the worst case scenario in such cases?
So likewise, I have told that it can affect the other areas of the other systems of the body also. So it can affect the major systems, like it can affect the heart, ventricular fibrillation can be there, or hypoalbuminemia can be there, like post erythrodermic psoriasis, excess water loss, excess fluid loss can be there. So in that case, is see, everything is of skin only. Skin say, I said secondary infection can occur because of disruption of the skin surface. That can be one of the things. So that has to be also managed side by side.
Right. So basically, people who normally has a tendency of trying everything and then visiting the doctor, we are uh, again and again saying this कि please आप initial stage में condition को treat कीजिए. कोई भी changes अगर आपके skin में आपको नजर आ रहा है, so make sure you're going and visiting your nearest expert just to have a check. A routine checkup every 6 months, very much necessary. Please do not prolong your condition. In such scenario, अगर हम पैसा बचाने का बात कर रहे हैं, normally what happens is we try to save some money कि खुद से घर पे ट्रीट कर लेंगे, कि डर्मेटोलॉजिस्ट के पास जाने का जरूरत नहीं है, फिर डॉक्टर एक कितने सारे ट्रीटमेंट देंगे, फिर कितने सारे टेस्ट देंगे, फिर एक टेस्ट करवाने जाएंगे, फिर 10 बीमारी निकलेगा, फिर उसमें 10 खर्चे. डोंट डू दिस. टुडे और टुमारो यू हैव टू ट्रीट योर कंडीशन. तो इनिशियल स्टेज में क्यों नहीं, आपको भी राहत मिलेगा, आपके जो डॉक्टर रहेंगे उनको भी थोड़ा सा रिलीफ मिलेगा, प्लस जो मॉनिटरी इशू के बारे में हम बात कर रहे हैं वो भी कहीं ना कहीं हम देखेंगे कि कम ही खर्चे में हमारा हो जा रहा है. So please, treating your condition in the initial stage from an expert is very much important. Now moving ahead, I can see some questions coming up from the viewers. The first question comes from Pooja Sharma. पूछती है, can psoriasis appear on the face? We were just talking about it.
It's very, very rare, almost generally not seen on the face.
Mm-hmm. Doctor, can hygiene also be a cause behind the occurrence of psoriasis?
See,
Poor
it can
hygiene.
be, no, actually, it is total autoimmune theories are there. Okay.
Mm-hmm,
Poor
mm-hmm.
hygiene, if it is maintained in psoriasis, it can lead to infection.
Right, right.
Yeah.
Now, let's also know about the kind of diet one should follow if the person is already suffering from the condition. Might be the initial stage, or a moderate one, or an extreme stage. What kind of diet should one follow? What are the do's and don'ts specifically?
Yeah. So diet, it totally depends upon the condition of the patient, whether the he's having some, if he's already having metabolic syndrome associated with psoriasis, then it should be a low calorie diet. Proper dietary advice has to be taken for this thing. um, like less oily food can be there, incorporation of vitamin C's, supplements, or vitamin C rich fruits and things has to be followed. Yeah, that can be one of the thing that has to be taken care of. Yeah, and then hello. Yeah,
Yes,
hello.
doctor.
Yes.
Yes,
So
doctor, we can hear you.
that has to be taken care of. So it depends totally on the patient. Like he's a diabetic, then he has to maintain his blood sugar level. So that has to be
Mm-hmm.
taken likewise.
Right. So basically, again, you see, we are talking about a healthy routine, a healthy diet. Try and eliminate sugar, fatty food,
Fruits,
junk food,
vegetables
बाहर के खाने.
should be, yeah, fruits, vegetables should be inculcated properly. It's like घर का
Right.
खाना is always the best.
राइट राइट अगेन द सेम थिंग कि हेल्दी खाइए. सिर्फ सोरियासिस के बारे में ही अगर हम बात करें आज, पर अगर हर बीमारी, हर कंडीशन के बारे में बात करें, डाइट प्लेज अ वेरी इंपॉर्टेंट रोल. प्लीज स्टिक टू द बेसिक डाइट. जो घर पे खाते हैं वही खाइए. कम तेल, मसाला, ऑयल, फैट, and of course sugar can be the worst thing you're doing to yourself. So try and eliminate such things. Now moving ahead towards the next question comes from Sona Sharma. She asks, can psoriasis cause joint pain?
Yeah, absolutely. That's what is psoriatic arthritis, which we are talking about. It can cause.
Right. The next question comes from Ram Gopal, who asks, how does psoriasis affect skin cells?
It's autoimmune. So basically, what is happening? The antigen which is getting expressed, that is basically it is entering to the defective epidermal barrier, and it is increasing the immune response. So that is hyperproliferation of the skin cells, and also which is leading to increased immune response. So antibodies are getting formed against the own cells. Okay.
Right. Right. And I believe this is the last question, which comes from Pooja Vishwakarma, asks, can pregnancy impact psoriasis?
Yes. It
Right.
has a
So,
very great.
so what if the mother who is about to deliver is having the condition, is suffering from the condition? Is there a chance that the baby can have it as well?
So it is not 100% that the baby is going to have. The baby is going to have the genes of
Hmm.
the psoriasis. Okay, but then
Right.
if that
Right.
is going to be expressed or not, that is not predictable. That as in how the
Hmm.
baby is getting older, we can
Right.
check for that.
राइट. नाउ फॉर ऑल द पीपल हु आर सिटिंग एंड वंडरिंग कि हमारे घर पे भी कोई इसी कंडीशन से सफर कर रहा है, हु नाउ ऑल ऑफ अ सडन हैज रियलाइज, अरे मैंने तो ये देखा है. आई मीन नॉर्मली ड्यू टू लैक ऑफ नॉलेज लोग कुछ करते नहीं है उसके लिए. दे जस्ट थिंक कि अरे एलर्जी है, अरे इचिंग है, अरे ड्राई स्किन है, ठीक हो जाएगा. So what if people are realizing right now after watching this live, ki I have seen this condition? What can be the prevention strategies for those people uh, who thinks that they can have it in their genes?
So that we can't predict actually, madam. See whether we are going to have psoriasis or not. Just the initial, when we see the signs and symptoms, when we start experiencing them, we can go and for that. Otherwise, a person who's having a dry skin or like that, they can start applying moisturizers. They can start applying proper, depending upon the skin type. They can apply that. But then psoriasis is not going to be dependent. That if you're following everything, if it's not that you won't get it. Okay, if you're bound to get it, you will get it. It's not in your
Hmm.
hand whether to get it or not. लेकिन प्रॉब्लम होने के बाद प्रॉपर ट्रीटमेंट दैट इज इन आवर हैंड. ओके, सो दैट इज वेरी इंपॉर्टेंट.
Right. So
Things are beyond the
today we
control.
have. Right, right. So, lastly, doctor has said that this is beyond our control, but it can definitely be managed. It can definitely be controlled if you are under a proper treatment, or if you are leading the life in the right way. Again, we have talked about a lot of things which are related to psoriasis. Uh, we have known about the treatments. The causes behind it, the right way to deal with it, the kind of food habits which one should include in the life, the kind of lifestyle changes, the triggers. Um, After everything, I believe now people know the name of the kind of this condition, and the worst effect of the condition. Also, that treating the condition is very much important in the initial stage. Doctor, we had a wonderful discussion regarding the topic today. Before we take a leave, any take home message for our viewers who has watched us so far?
Take home message is the same thing that a stitch in time saves nine. So when we see the signs and symptoms, when somebody is experiencing the dry, scaly, erythematous papules or plaques on the body, don't ignore them. Just properly diagnosis and proper treatment is very important. It is better if it is taken in initial stage, so that it is going to save, it is going to make the life more better. प्रॉब्लम हो गया है, अभी मेरी जिंदगी खत्म, like this it should not be there. That anyone should
Hmm.
not think that way. Properly staying with them and fighting and bouncing back, that is important. So
Right.
life में भी यही important होता है. We have to face it. We have to face psoriasis. If some patient is having psoriasis, they have to face it. They have to face it properly.
Hmm.
उसके साथ प्यार से रहना
Hmm.
चाहिए. ऐसा नहीं कि फ्रस्ट्रेट होके.
Right. Right. And I think there is no fear at today's time where medical science has evolved drastically. हर चीज का treatment available है आज के डेट में. There is no such thing which can't be treated. You just need an expert guidance. And that was the expert advice for today. Thank you so much, Dr. Prachi Prashant Mahajan, for your valuable time. It
Thank you,
has
madam.
been a
Thank you.
very
Thanks for
informative session for
supporting
our
me.
viewers, and I'm sure they will use this piece of information to prevent themselves and their near and dear ones from getting psoriasis. In case they get to see such symptoms, now they know what to do. Instead of self medication, it's always better to approach a nearby dermatologist. It was great to hear from you, and we look forward to many more such sessions in coming time with our viewers again. Also, thank you, viewers, for your excellent participation in today's session. And to get the latest updates on how to keep your skin healthy, do like and follow our Facebook page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay
Thank
healthy.
you. Namaskar. Yeah.